It could soon be easier to find out where and who to look for when people need help with issues related to mental health. A guide linking individuals to the right place and the right people is currently under review. Now, it's one of key talking points brought up during public consultations by the Inter-Agency Taskforce on mental health and well-being. And Lauren Ong tells us more.
It's not always right on the first try. At least for one social worker, getting the right help requires some trial and error, and going back and forth among agencies isn't ideal for those looking for help with mental health.
When I want to refer clients to a specific place, sometimes it can get a little bit confusing as to, which agency should I refer to them? And something that we want to avoid is making sure that the clients don't come back to us and tell us that, I called this agency and they cannot help me.
Well, it could soon be easier. The task force is reviewing a new guide that will help people link up depending on the severity of their illness. The guide differentiates mental health needs into 4 categories. In the most serious of cases, specialist care by psychiatrists and psychologists is recommended. On the other end of the spectrum, those in need can do with self-help guides and peer support. The system would list where these individuals can turn to for their specific needs, like the Institute of Mental Health for those who need the most help. How this will be implemented is still in discussion.
We hope make it less likely that people will have deteriorating mental health conditions, but as well more likely that if they are deteriorating, they'll get help sooner and get referred to the right place faster. And so we see that as a central piece in some of our recommendations.
Public consultations online and in person have been ongoing since May. Over 400 individuals have taken part in these small engagement sessions. They represent stakeholders from different profiles and sectors, like health institutions, employers, persons with mental health conditions, and their caregivers. The other half have voiced their views through an online survey. Ideas suggested could also plug gaps in the current services available.
Certain places like IMH or the emergency departments of our restructured hospitals get a disproportionate burden of dealing with issues like emergencies or crises. So if we can move upstream, provide resilience, earlier counseling services, earlier interventions, then we don't have to force everybody to come for a crisis intervention. Right?
Other ideas include educating medical frontliners with skills to identify mental health distress. More reviews will be conducted, and ideas accepted will be implemented in stages.